Bismillahirrahmanirrahim. Welcome back. Ramzan Mubarak, everyone. Today we will discuss mainly about the Cushing syndrome. Now, first question arises that how this Cushing syndrome is caused. What is the Cushing syndrome? So, Cushing syndrome is caused by various conditions that produce the elevated glucocorticoid levels in your body. Elevated glucocorticoid. In Cushing syndrome, you will see that the level of glucocorticoids in your body is raised. Okay, so what is Cushing syndrome? Cushing syndrome is caused by various conditions that produce elevated glucocorticoid levels in your body. Now, how the level of glucocorticoid rise in your body, what could be the causes, various causes. There are mainly two main underlying causes. Now the first is the exogenous, the source of glucocorticoids, raised glucocorticoid levels. The first is exogenous and the second is endogenous. Exogenous means that for any other ailment, your doctor prescribe you the glucocorticoids because they are the anti-inflammatory, and in various conditions your immune system is hyperactive and you need the glucocorticoids as a drug of choice. So in that conditions, when you give exogenously the glucocorticoids, in a side effect you may develop the Cushing syndrome, and this kind of Cushing syndrome is known as iatrogenic Cushing syndrome. What is it called? Iatrogenic, because it is due to the medicines, due to the medicines, that is glucocorticoids. Now second, we discuss about the endogenous causes. In endogenous, it is further divided into further two types. The first is the ACTH dependent. What is first? First is ACTH dependent. I will discuss what is meant by ACTH dependent. And second is the ACTH independent. Now I tell you that in endogenous causes in your own body, the glucocorticoids is producing excessively. In ACTH dependent, there could be any pituitary tumor which is excessively producing the ACTH, and in response to that ACTH, your adrenal glands are excessively secreting the glucocorticoids. That would be called as ACTH dependent, because the level of ACTH is raised. That's why the glucocorticoids are excessively secreting. While the second is ACTH independent. In this case, there's no role of ACTH. Instead, in the adrenal gland, there is any kind of tumor which is excessively producing the glucocorticoids. In that case, even in your body, the level of ACTH would be decreased due to negative feedback inhibition. Now I discuss the examples of ACTH dependent and independent. In ACTH dependent, the first is pituitary adenoma. What is first is pituitary adenoma, and that is ACTH secreting. In 70% cases of the endogenous, this is the underlying mechanism, underlying cause. ACTH adenoma, pituitary adenoma, ACTH secreting, which secretes the ACTH, and then your adrenal gland produce excessively glucocorticoids. While in, and the second could be the ectopic corticotropin syndrome. What is it? Ectopic corticotropin syndrome. In this condition also, ACTH is excessively being produced. That in any other sites, the corticotropes are present and they are excessively synthesizing the ACTH. While in ACTH independent, there could be any adrenal adenoma or adrenal carcinoma. Adrenal adenoma or adrenal carcinoma. So what we discuss about the Cushing syndrome is due to raised glucocorticoid levels, and the source of the raised glucocorticoid level could be the exogenous one, iatrogenic, that from you yourself are taking the glucocorticoids And the second is the endogenous, that in your body the glucocorticoids are being produced, and we discussed that they could be the ACTH dependent and ACTH independent. And in ACTH dependent there could be the ACTH secreting pituitary adenoma or ectopic corticotropin syndrome, while in ACTH independent there could be adrenal adenoma or adrenal carcinoma. Now we will discuss about the clinical features of the Cushing syndrome, that how these patients are going to present to you. What would be their symptoms, what would be their complaints. Here I draw a diagram of a man. Now the first you will see that in the Cushing syndrome patients, these patients would be having the secondary hyperglycemia or diabetes. Secondary hyperglycemia, because glucocorticoids they increases the production of glucose, so in your body there would be secondary hyperglycemia. Second could be the hypertension. Blood pressure of these patients would be raised. Third, the weight gain. You see the tummy of this patient, that it has gained the weight, and the weight is the adipose tissue. It is specifically deposited in an areas like in the face, in the shoulders and back. So these patients would have characteristic moon shaped face and buffalo hump. Weight gain, you can say moon shaped face and buffalo hump, that their neck would be in the back there would be excessive adipose fatty tissue, buffalo hump. And the fourth could be hirsutism, that in females you can see that there should be a mustaches and beard. It could be and excessive hair growth could be occur. This is due to as glucocorticoids are level are raised, somehow the androgens level are also raised, and this could be the responsible for the hirsutism. Other features of these are these patients are, you will see the osteoporosis. They have increased risk of fractures, their bones are weakened. Second is due to the loss of collagen, these patients would have the thin, fragile skin. Thin, fragile skin, easily bruisable, and there would be the cutaneous stria would be present because there is loss of underlying collagen tissue. Cutaneous stria would also be present, and because glucocorticoids, you know, they are anti-inflammatory, they suppress our immune system, so these patients, they have the increased risk of infection, increased risk of infections. And second, the muscles of these patients would be suffering from proximal myopathy, proximal muscle wasting. So, and second, they would also be suffering from the mood swings and frank psychosis. Mood swings would also be present in such patients. So I will revise that what are the clinical features of such patients. First, they would be having the secondary hyperglycemia, then they would be having hypertension, weight gain, characteristic moon-shaped face, buffalo hump, hirsutism, and then osteoporosis. They would be having the thin, fragile skin, cutaneous stria would be present. They would be having the increased risk of infections, proximal myopathy would be present, and they would also be having the mood swings. Now we discuss about the lab diagnosis, that how we will diagnose the patients of Cushing syndrome. Lab diagnosis. we mainly focus about on two main things. The first is the serum ACTH level, and the second is measurement of the urinary steroid excretion after administration of dexamethasone. What is that? Urinary steroid excretion, specifically after administration of the dexamethasone, and this is known as dexamethasone suppression test. What is it called? Dexamethasone suppression test. In this test, we will give patients exogenously the dexamethasone. It is actually a synthetic glucocorticoid. Now we will see that what is the response of the patients after administering the dexamethasone. In case of the pituitary Cushing syndrome, the ACTH levels would be raised definitely. In pituitary, what will happen in pituitary Cushing syndrome? You know that in that case ACTH levels would be raised. When you will administer the dexamethasone in these patients, these raised ACTH level would not be decreased if you will give the low dose of dexamethasone. But if you give the high dose of dexamethasone, then the level of ACTH would also be decreased in serum, and in urine the excretion of steroid, it would also be decreased. So how we will diagnose the pituitary Cushing syndrome? That low dose of dexamethasone, there would be no effect on serum ACTH and there would be no effect on urinary steroid excretion, while the high dose of dexamethasone, there would be decrease in serum ACTH and there would be decrease in urinary steroid excretion. Via dexamethasone suppression test, we find the cause, that what is the underlying cause. Now first we discuss about the pituitary Cushing syndrome. Second could be the ectopic ACTH secretion. In ectopic ACTH secretion, this ACTH is coming from an ectopic sites, so it would not be influenced by the dexamethasone. So either low dose or high dose, there would be no effect on raised level of ACTH. And the third, in the adrenal tumor, if there is an adrenal tumor, in that case the level of ACTH would be low due to negative feedback inhibition. In the same case, the serum ACTH level would already be decreased, and if you will give the dexamethasone, in that case, in the same way like ectopic ACTH secretion, there would be no effect on urinary steroid excretion there's no effect on the urinary steroid excretion of either low dose or high dose dexamethasone. This was all about the lab diagnosis. I am repeating that in lab diagnosis you mainly find the serum ACTH level, and second the urinary steroid excretion level, and you perform the main test, that is the dexamethasone suppression test. It is mainly to determine the cause of Cushing syndrome. There are mainly three broad causes of the Cushing syndrome. How you will differentiate via the dexamethasone suppression test? In pituitary Cushing syndrome, the raised level of ACTH, in low dose of dexamethasone, no effect on ACTH no effect on ACTH, and there's no effect on urinary steroid excretion, while in ectopic ACTH secretion, both low doses and high doses, there's no effect on ACTH secretion. The level of ACTH would be raised, while in adrenal tumor the ACTH level is already decreased due to negative feedback inhibition. Now this was all about the Cushing syndrome.